Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Tonight on Health Watch, we're talking about depression, a condition that affects 1 in 7 women in the United States. Dr. Byatt, what is depression?
Depression is a medical illness, and it's very common. It occurs in up to 1 in 4 people, and typically, it's a lot of symptoms that people can experience, including some physical ones.
How is depression diagnosed?
Typically, it's diagnosed through a clinical interview. Primary care office may use a screening tool to see, do we need to ask them more about depression? And then that's typically followed by a clinical interview to be able to get a better sense.
Is depression more prevalent in women than in men?
It is. Women are twice as likely as men to actually experience depression.
Why is that?
We think it's a number of things. So women tend to be more sensitive to hormonal fluctuations, and we also have more hormonal fluctuations than men do. So menopause, having a baby, getting our menstrual cycle. And women also may be more likely to talk about depression than men. They're more likely to go to a physician or a healthcare provider.
How common is depression with people as they age?
As people get older, there's some increased risk factors for depression because people may lose loved ones. They may also lose some of their own physical or mental abilities, and people can get really isolated. And a lot of those are risk factors for depression.
How can therapy help a person's mental health?
One of the really important to think about with depression is it's so common. It's a medical illness just like many other illnesses. Going to therapy and getting psychotherapy should be like seen as going to the dentist. It's something that you do to ensure your mental health, and it can actually make it less chance that you're going to experience depression because you are able to understand yourself and be able to react differently to things in your life.